This is Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation and chronic daily migraine survivor. I am lucky enough to be here today with Dr. Betsy Seng. She is a health psychologist, an associate professor at Yeshiva University and Albert Einstein College of Medicine. Hello, how are you, Dr. Seng?
I'm doing well. I'm so happy to be here.
Thank you so much for being here. We have a really exciting and really important topic today, and we are actually going to do more than one episode related to things that Dr. Seng is going to talk to us about. We're going to be talking about behavioral things that we can do to help our migraine and headache disorders. Today, we're going to talk about biofeedback. And I wanted to introduce this by saying that this group of episodes that we're looking at, one of the things that I think we've all noticed in migraine medicine and headache medicine is that sometimes as patients, we are made to feel when we go to do these techniques that maybe we did something wrong that caused our migraines, and that's why we should try biofeedback or cognitive behavioral therapy. And really, this is not the way that we should look at it. The way we need to look at it is we have a disorder that causes excessive pain, excessive disability, and we need to be superheroes to overcome it. And these are some of the tools, some of the pieces of the pie that have been shown to be very helpful to work on and help us to get through this, improve our lives. So without further ado, let's talk to Dr. Seng, because she is a specialist in working in these matters. So Dr. Seng, can you start out by telling us what is the general goal of biofeedback and what is it in relation to migraine?
Yeah. So I think that some of the things that you just said are important enough to reiterate too, that when someone with migraine is referred to a behavioral specialist to treat migraine, it's important that it's a behavioral referral to help cope with a medical condition. It's not a psychiatric referral.
Right.
So we want to make sure that you're being referred to clinicians who are familiar with strategies, not just to treat things like depression and anxiety, but are familiar with strategies to treat migraine itself. Some of the strategies can overlap, but the way they get implemented is really, really different in the lives of people with migraine. The second thing, before we get to goals of biofeedback specifically,
right,
is that the things that we're talking about don't cause people to have the disease of migraine.
Right.
Migraine is the disease, and some people have it and some people don't.
Right.
And the problem is that when people have the disease of migraine, they have to be much more careful about lifestyle issues, keeping a really consistent lifestyle, keeping consistently low levels of stress, being more aware of their bodies than people without migraine. It's not fair, but these fluctuations in hormones and other things going on in our bodies and brains can contribute to higher migraine attack frequency in people who already have the disease.
Right.
So, there's nothing that, none of these things would have prevented you from having the disease. But once you have it, there are lifestyle changes that we can try to help make that will reduce the disease frequency, and one of them is biofeedback.
Right.
So the goal of biofeedback is to help you learn about your body's patterns. There are basically two ways that your body and brain interact to help you cope with the day. They're called the autonomic nervous system. One of them is the fight or flight system. That's sometimes called the sympathetic nervous system.
Right.
The fight or flight system activates your body and gets it ready to fight or flee.
Right. Which is almost always on in us because we're in pain.
Yes, absolutely.
Yeah.
So it's on all the time. And it's really, really useful for things where fighting and fleeing and lightning fast reactions are important. Like if a kid runs in front of your car on the street, right? You're pounding on the brakes before you even know what's happening. Your sympathetic nervous system was engaged.
Right.
The problem is that fighting and fleeing are not really effective strategies for dealing with most of the daily stressors of life,
right,
or for dealing with pain and migraine attacks. So the parasympathetic nervous system, which we call the relaxation response, is the system that is better equipped to help our body deal with the kinds of stressors, especially things like migraine attacks, that occur in the daily lives of people in general, but also people with migraine.
Mm-hmm.
The goal of biofeedback is to help you start to really learn when your body is flipping into fight or flight, mm-hmm. and how to wrangle it back, right, to be in the relaxation response.
Okay.
It's different for everybody. And that's why we use a lot of, different ways to help people get their body back into the relaxation response.
Okay. Well, can you give us a quick overview of the types of biofeedback that are currently available out there?
Yeah, there are lots. So a lot of the early studies with biofeedback with headache and migraine broadly used EMG, so muscle tension, and you put little pads on your head, or used thermal biofeedback or temperature biofeedback, where you put a little thermometer on your finger, and it tells you how warm or cold your hands are. That's associated with the dilation of your blood vessels. Mm-hmm. The goal is to hand warm, which opens up your blood vessels and is associated with the relaxation response. Right. Most of the studies for biofeedback with migraine were conducted in the 80s and 90s and early aughts. And those are the most common types of biofeedback available. Most of the studies have shown that thermal biofeedback, or that hand warming biofeedback, is effective for migraine. However, there are some newer kinds of biofeedback that clinically, I think, show a lot of promise, but we haven't been able to study them quite as rigorously yet. The first is heart rate variability. So heart rate variability biofeedback, rather than just trying to get a low pulse, what you're trying to do is to keep your heart rate steady. And that's very, very difficult to do. Mm-hmm. And once you get in this kind of mode where you have a very, very steady rhythmic heartbeat, that's a very good indication that you're in the parasympathetic response. So that's a lovely kind of biofeedback. There are also some newer forms of neurofeedback. They all differ in various ways, but that I think are showing promise, but that don't have the same kind of research base as thermal biofeedback or EMG.
Okay, so you sort of answered my next question. I was going to ask which type of biofeedback showed most promise for people with migraine, and you said it was the thermal biofeedback. Yes. And I think this is important to capitalize on for people who are watching, and I'll tell you why. It can be a very confusing process to get referred to get biofeedback, and once you get there, you have no idea what you're getting. And it was years ago that I was trying to go through this process, and I didn't get thermal biofeedback, and the only type of biofeedback that was there was not thermal. So at least I think people should know which one has been most studied in migraine, so they know what to ask for and what to look for once they do finally get to a place where they can get it. Who is qualified to carry out biofeedback?
So there is an association, the American Association for Biofeedback, and they have certifications for people who are specifically trained in biofeedback. Okay. The biofeedback technicians can be people with really any level of clinical training. Okay. So the question is, are you somebody who wants to just learn how to use this new skill? Mm-hmm. In which case, really any level of person who conducts biofeedback is probably fine. Mm-hmm. Or are you someone who wants to really be able to learn this skill because you want to use it to approach your migraine attacks? Right. And in that case, you probably want to be going to a clinical psychologist who has a health psychology background. So in the beginning, you introduced me as somebody who has a background in health psychology. Right. And I think that that's important. So health psychologists are trained to treat medical conditions, not just psychiatric conditions. Right. And that's a helpful place to come from. So we're used to treating people with all sorts of medical diseases, chronic pain, diabetes. And when we are then able to apply biofeedback skills to somebody with migraine, we can help not just teach the skill, but integrate it into your life as a person with migraine.
Okay. And I also think that is very important. You need to know who you're going to. You need to know the level of training you think you might need to fight your migraine disease. And then, if you get called by a psychologist's office and you just thought you were going for biofeedback, you need to know why. It is often these types of offices that do this work.
Yep.
Is biofeedback usually carried out during a migraine attack or when the person is feeling well?
Biofeedback is a preventive migraine strategy.
Mm-hmm.
And I like to think about biofeedback as something that's just like training for a marathon. You have to get your muscles ready, because if you want to use it in the moment, you're not going to be able to all of a sudden, engage the relaxation response in the middle of a disabling, painful attack.
Right.
You need to get ready. So in general, when someone is learning how to do biofeedback, they might actually use multiple types at a time. When you go into the biofeedback clinician's office, they may show you 6 or 7 different leads of a whole bunch of different systems, hopefully including both EMG, thermal, and others that show you all of your autonomic responses, and it's a little overwhelming. Then they're going to they're going to practice with you in the moment to see how you can calm it down. They'll teach you a bunch of different strategies. Then when you go out into the real world as a person with migraine, you probably want to practice every day. You want to say, okay, how can I get my hand warmer? All right, I'm going to try this today. That didn't work very well. I'm going to try something else the next day until you find the strategies that really, really help you. Then in the moment, right before a migraine attack, when you can feel it start to come on, you have to make decisions about, am I going to treat now? Am I going to remove myself from the situation? And biofeedback might be a useful strategy in that moment. You don't even need to hook yourself up, because hopefully you've been practicing the skill enough that you can say, I'm going to take 5 minutes. I'm going to take a big glass of water. I'm going to take my acute medication, and I'm going to practice some of this relaxation response stuff that I've learned through my biofeedback. And if I'm still not feeling okay after 5-10 minutes, then I'll go home.
Right. So my next question was, how do we translate it into our lives, and how do we take those skills and apply them? And I think you've pretty much answered it. You practice it, and then you use it. You feel that migraine coming on, and you take that 5 minutes and you learn to either abort that attack, or make it part of your strategy to abort that attack, or to decrease the pain level and the disability involved in that attack.
Exactly. These are things that you can do. Even if you decide, I have to remove myself from the situation, the attack is not being aborted. This is going to be an attack where I have to go home and take care of myself. Sometimes using the strategies that you have practiced a lot with biofeedback can be nice and distracting. And it helps you stay in the relaxation response as much as possible when you're in pain, and can help distract your mind from the attack, which can help reduce the amount of pain severity that you feel in the moment.
Right. So how long is the training, and how many sessions does it usually take for a person to become good enough at this that they can actually affect their migraine disorder?
It's going to take a couple of months. You can often see changes start to happen after you've been practicing diligently for a couple of weeks to 1 month. And then you'll want to continue working with your biofeedback practitioner for another month or 2 after that to make sure that you really have what we call skill consolidation, so that you have learned it, you know what to do when barriers come up, and you feel confident that you can continue to tackle migraines with it. You may not meet with somebody every week. You might meet with somebody every other week. They may give you some homework to try. A common thing that you might try with biofeedback, you go into the clinician's office, they show you all these leads. They show you all sorts of biofeedback. They give you a hand thermometer, and they say you're going to practice with hand warming, but there may be a lot of different strategies that work for you. So for some people, thinking about their hands becoming warm and heavy really, really works for thermal biofeedback. But for some people, that feels a little anxiety provoking, and is the last thing that you want to do. So those people, they might imagine a white light, or might imagine themselves in a very comfortable place, or their vacation spot. There's all sorts of mental strategies that a person might use to get themselves into the place where they're actually able to warm their hands. You're going to have to try them all. You're going to have to try a bunch of them, trial and error. So it takes practice and it takes work, but the work can be worth it if you're somebody for whom being in that fight or flight system all the time is a problem.
Yes. So what percentage of migraine patients do you think see results by using biofeedback as a technique?
So, it depends on what we necessarily are talking about by results. I would say that the majority of patients that I have seen in both my clinical practice as well as the studies that I've been involved with have experienced some kinds of reductions in headache-related disability, and they're, feeling like they can manage this disease. In terms of statistically significant reductions in headache frequency, which is our primary outcome for these kinds of studies, about half of patients are going to be seeing, statistically significant reductions in headache days with biofeedback.
That is a lot.
Yeah. So it's a pretty good response rate. The biggest problem with studies with biofeedback, and I think that this is also true in my clinical work, is that you do have to stick with it. Okay. And if you look at people who complete a program of biofeedback, they're doing much better than people who try a couple of sessions and have a hard time doing the homework in the middle and just say, you know what, this just isn't working. It isn't for me. So I would say that for all behavior strategies, it's important to know that the change doesn't happen when you meet with the clinician. The right. change is you. You are becoming an expert in your own migraine attacks and your own lifestyle. So if you're not in a place where you're ready to devote half an hour to an hour a day, working on skill building to help reduce migraine attacks, it's not the right time. The holidays are probably not the right time. Right. A vacation is not the right time. Right. And you want to be thoughtful about the next 2 months of my life. What do they look like? And is this important to me?
Right. That's very important information. And I also want to point out that when it comes to studies of things that decrease migraine or improve our lives, 50% is a big number. That's something that we don't come up with a lot. So I do think this is a very effective strategy to people who are motivated enough to work on it. If someone is watching and wants to try biofeedback, who in their community should they seek out?
The very first thing that I would do is that I would go to either the American Association for Biofeedback website or the American Psychological Association's Find a Psychologist. It's a psychologist finder website. And I would look and see if there are any either biofeedback clinicians or psychologists who specialize in health psychology in your area. And those people are likely going to be able to help provide this particular kind of treatment.
So is there anything else you'd like to add to our topic of migraine and biofeedback?
No, I hope that people who feel like it could be useful, give it a try and see how it can impact their lives. Okay. I think that for a lot of people, even so there are some evidence-based applications like mobile health applications and things like that can get you started. They're not going to be migraine specific. It's not going to be a clinician who helps you understand how to work it into your life to treat migraine attacks. But it's a good way to dip your toe in the water and see if you feel like you could tolerate a couple of months of really working on this skill.
Okay. All right. Well, thank you, Dr. Seng. Thank you for being with us. And thanks everyone for joining us. And we will see you again next week on Heads Up, the weekly podcast of the National Headache Foundation.